Hi mums and dads, I'm Dr Nelu, a paediatric doctor, and I'm here to chat about children's health. On today's episode of Kids Health, we'll find out about the most common rashes we see in kids. We'll speak about paediatric mental health and the unfortunate rise of bullying. And finally, I'll chat to therapist Vanessa Leongue about therapy sessions in children. But first, I'm going to have a chat to adorable 7-year-old Alicia and find out about her eczema. Alicia, I am so excited to have you on the show. Thank you for joining me.
Hi.
Hello. Alicia, how old are you?
7.
You're 7. Oh, how old do you think I am?
33.
Oh, not a bad guess. Not a bad guess. Not quite, but not a bad guess at all.
32.
No, oh, you're getting a bit further away, but that's okay. You don't have to guess my exact age. Now, Alicia, do you know what I do for work?
Are you a doctor?
I am a doctor. Do you know what doctors do?
No.
Have you ever seen a doctor before?
Yeah,
What did you see a doctor for?
to remove my tonsils
Oh, you had your tonsils taken out. How long ago was that?
last year.
Oh, so pretty recent. Do you remember it?
Not that much.
Do you remember going into hospital?
Yeah.
What was that like for you?
Bit scary.
Oh, why was it scary?
I didn't know what they were going to do. I thought it was going to hurt a lot. But actually it turned out not to hurt. But at the end I started crying.
Oh, that's fair enough. It is a bit scary going into the big room and with all the lights and everyone dressed up, isn't it?
They gave me a cuddly toy before I went in. And when I was taking my tonsils out, they told me to blow on something. It was like a balloon. And then my eyes started getting tired and I just went to sleep and then they did the operation.
Oh, so that's all that happened. You just had to blow in a balloon and then you fell asleep.
It was a special kind of balloon. It wasn't exactly a balloon, they taught me. That just think of it as a balloon you're blowing up.
Oh, that sounds like magic. And then when you woke up, did you have any pain?
A bit. My throat was hurting a bit.
Yeah, and
But I got to eat lots of ice cream.
why did you get to eat lots of ice cream?
I had to eat cold things.
So you picked ice cream. That's not a bad choice. And how long could you not eat things like chips and stuff for?
A week.
About a week. Yeah. And then after that, when the pain started to get better, were you able to eat normally?
Yeah.
Why do you think you needed to have your big tonsils out?
Because it was getting too big and it was hard to eat a lot.
It was hard to swallow. Okay. So now can you swallow better?
Yeah, my mom said to make it into a blender and just shake it up and I can drink it.
Was that before when you had the big tonsils? Oh my gosh, so you had to blend your food. So it was actually really hard to eat. Oh, you poor thing. And why is food important for you?
It makes me grow a bit.
Yeah, so food is important to grow. Is there any other reason why food is important?
To make me think more.
Is all food good for you, or there are some foods that you shouldn't eat too much of?
Yeah, one food.
What's the one?
Sugar.
Sugar. But a sugary food's yummy?
Yeah.
Yeah, it's a bit tricky, isn't it?
There's cotton candy that I eat all the time and it tastes so good, so I can't stop eating it.
What does your mum say when you eat too much cotton candy?
If I eat too much, then I have to eat vegetables.
So vegetables good for you?
Yeah.
Why are vegetables good for you?
It makes me smarter.
So do you eat all your vegetables all the time?
Yeah, the least vegetable that I hate is mushrooms.
Mushrooms, yeah, mushrooms are they taste a bit funny, don't they? What's your favorite vegetable?
Probably cucumber.
Oh, really? Cucumber. That's a good one. Now, have you seen the doctor for anything else before?
A rash.
A rash. What was the rash?
I have one on my face.
Okay. Well, do you know what the rash was called?
Eczema.
So do you have eczema, Alicia?
Yeah, only on one leg and my face, that's all. I don't really have it on my arms and stuff.
Okay. Can you tell me what eczema is?
Something you get with spots that's always really itchy. It's not that itchy if you put cream on every day like I do.
Oh, aren't you a good girl? So do you put cream on just on your eczema patches or everywhere?
Everywhere. Mostly after I take a shower.
Why does it help the eczema?
I don't know. I think it's because it gets more moisturized.
Yeah, that's very true. Well done. Well, I'm very proud of you for putting your cream on every day. Now, Alicia, do you have any questions for me?
What is your favorite part of being a doctor?
My favorite part of being a doctor? I think it's working with the kids. I love to meet all the awesome little children. And one thing that I've learned is that children are so amazing and they are always smiling. And even if they're going through a really hard time, most of the time they're happy and they're just really awesome. So that is definitely my favorite part, is meeting some awesome, awesome little kids. Thank you.
Do you feel like scared when they're really like hurt?
I do feel a bit scared sometimes because I'm worried that we can't do everything we can to make them better. But, most of the time we can, which is really good. That's a lot of questions. Do you have anything else you want to ask?
Not really.
Not really. Okay. Well, can I ask, what would you like to be when you grow up?
In fact, I have 3 things.
3 things.
I want to be a famous singer, a famous dancer, and acrobatics.
If you had to pick one of those things, which one would you pick?
Probably singing, because I always do it at home with my dad.
Okay.
Because he loves singing too.
Thank you so much for chatting to us today, Alicia. It's been an absolute pleasure.
Thank you.
Yeah, thank you for joining us. See you, Dal. Children often get rashes, and they can be from all sorts of causes. Things like infections, allergies, or skin conditions like eczema. The most common cause of a rash in a child is an infection, and of them, viruses are the most common. It's very common for kids to get a small, bumpy pink rash all over their body that may come and go and move around. The rash disappears when you press on it. Sometimes they get the rash at the start of the viral illness, and with other viruses, the rash comes up at the very end, after the fevers have disappeared and the child starts to get better. And these are all really harmless rashes that come along with the virus. Other viruses can cause more irritating rashes, like the hand, foot and mouth rash that's blistery on the hand, feet or mouth, the measles rash that's red and blotchy all over the body, the chickenpox rash which is very pimply and blister-like with fluid that can be very contagious. The next type of rash to talk about is hives. So that's the raised bumpy rash that we often see with allergy. What many parents don't know is that viruses can also cause hives as well. These can be really itchy spots, but antihistamines tend to help a lot. The important thing with hives is to think about whether there could be a trigger. Could it be food related or related to pet hair, for example, or medication, or could it be that the child has a virus? It's a good idea to see a GP once your child has had a hives rash. The other rash that we see a lot of that can often bring children into hospital is eczema. Eczema is when there's an issue with the skin barrier and the moisture in the skin barrier. The main triggers for eczema, things like overheating, particularly in winter when it's really cold and children are wearing lots of layers and there's a lot of heating on, irritation from other products, so such as creams and bath washes, and food can trigger eczema as well. Eczema can also become infected, particularly if the children are scratching the eczema spots. Bacteria from their skin can go into the eczema and can cause infection over the eczema, which can be really quite painful. The main thing with eczema is to 1, avoid the triggers. So if you know that overheating or certain foods trigger it, avoid them until the skin is under control. Number 2, which is probably for me the most important, is to moisturise. Moisturise with a good thick cream twice a day if you can, but ideally after a bath. Oil in the bath can be really helpful as well to keep in that extra layer of moisture. Helping to control the itch, so keeping the nails nice and short and keeping the skin nice and moist can help control itch. Your GP can chat to you about wet dressings as well, which can be quite helpful. And there are other treatments such as steroid medications or bleach baths or antibiotics that can be very helpful for eczema. A GP is a great resource for eczema management. Otherwise, there are some fantastic websites listed below that can be really helpful for parents who are trying to manage eczema. With the rashes, they can look quite concerning, and if you're worried, always make sure you seek help. The main rash that we would be concerned about is a dark red rash that doesn't disappear when you press it. Particularly if your child is unwell or has a fever, with that rash, we would recommend seeking urgent help. Apart from that, for any rash that you're concerned about, you should see a doctor either at the start, if it continues longer than expected, or if anything changes. Bullying can be verbal, physical, social or cyber over the internet. We're seeing this more and more in the community, and we're seeing more children impacted by this. It can lead to long-term mental health problems and can leave lasting effects on children. Now, not all children speak to their parents about it, so it's something that parents should just be aware about. If you suddenly notice that your child is avoiding situations, if they've become quite aggressive or quite teary, if they've had a massive change in their eating or sleeping habits, they're refusing to get out of bed, or a change in their physical symptoms, so often lots of new stomach aches or headaches, it could be worthwhile just thinking about whether there's something going on that they're not really explaining to you, and particularly bullying. Now, parents can feel very helpless about this, and as a parent, I can imagine it would be very stressful to approach this with your child. There are a few things that you can do that can just set this up to make it a bit easier for your child to come and talk to you about it. You want to create a safe environment at home so that your child can feel comfortable talking about it, so that they can come to you if there's a problem. Check in often, especially if your child seems off. The other important thing to chat about is cybersecurity. So things like sharing their details with strangers, posting pictures, sending pictures to people. Children may not be aware of the complications and the consequences of this, so it's important to talk to them about it in a really open, honest and safe way. Making sure you speak to the school early, if that's where the bullying is occurring, can be really helpful. So speaking to teachers or the school counsellor to support your child through this can be a good first step. And ultimately, chatting to the GP and getting a mental health care plan for some formal psychology can also be extremely helpful for your child. Teaching them methods to cope and methods to deal with the bullying that could be going on. And I know it seems really scary that your child might need to have this sort of support, but making sure that you're aware of the resources and using them the best you can be really helpful to help your child through some really difficult times. Our next guest is clinical psychologist and registered nurse Vanessa Leongue. Vanessa has worked in medical and mental health with patients across the lifespan, but caring for children and young people is her absolute passion, and working with them through really difficult times in their lives. She's an absolute wealth of knowledge, and it is with pleasure that I welcome Vanessa to the show. Hi Vanessa, and welcome to Kids Health with Dr Nelu.
Hello, thanks for having me.
Very excited to have you on here. Now, you're a nurse and a psychologist. We're a double threat. Can you tell us about why you love doing what you do?
I think people are often surprised when they hear that I'm a nurse and psychologist. So I started off nursing first, and then I love nursing and still do. But I found that I often wanted to stay and chat to the patients and didn't have time to do that. I didn't want to do just all the practical things. I wanted to know what was going on in their mind and how they felt and were they afraid. And I think that's how it led me into studying psychology and becoming a psychologist.
Sounds so fulfilling. It's amazing the work that nurses and psychologists do. I mean, I obviously work with both groups of health professionals, so to be able to do both is amazing. Now, mental health in children is really tricky for so many reasons, but we know that children find it difficult to open up and may not be aware of some of the issues that are going on for them. Can you sort of walk us through what a traditional therapy session looks like for a child? Because many of our viewers may not actually know what this looks like.
Yeah, so therapy with a child is very different to working with an adult. It's a lot more playful. Sometimes it looks like we're just playing because we are. A child's language is still developing, so their way of communicating is through play. So even though we're just playing games, it is a way for them to learn a bit about self-regulation, about their emotions, about negotiating rules and expressing their creativity. When you are learning about emotions, whether it's about anger or anxiety, it's important to make sure that you're not sitting face to face, but you're possibly down the floor playing with the kid as well when you're doing that. So a therapy session with a child, it's important to involve the parents as well at some point.
So are parents present for the whole session, or how does it work?
I try to keep the parents there as much as possible. A lot of the therapy, I do want the parents there, so I may be there to guide some of the play that they have, because a lot of the work isn't about, a child coming in and fixing them, because a child exists within a context with a family, with school. And really, seeing a child for 50 minutes a week isn't going to tremendously impact on their entire life. So I do try to keep parents involved as much as possible.
Yeah, that's a really good point. I guess with children, we're looking at the whole family unit, aren't we? So it's quite a different experience to be a child psychologist. Is it different dealing with teenagers as opposed to adults, for example?
Yeah, well, I do take a developmental history of the child or young person first. So, for example, I recall one of my clients who was a 10-year-old. She presented as, quite mature and thought play was a bit childish. Even when it came to playing with kinetic sand or Play-Doh, she said, "Oh, this is for babies." But after exploring her history a bit more, I learned that an early chaotic family lifestyle where turns out she had to be a parent to her own siblings. Therefore, she never really got to play. She missed out on that. And play is a way for children to then explore their creativity and fears, and she missed out on that. So then I would then incorporate a lot more of that into our therapy. So it's not necessarily looking at their chronological age, but more their developmental, emotional age when I work with them.
Gosh, it sounds so worthwhile what you do, and I can imagine it would be really challenging at times as well. Now, is there any advice that you can give to parents who may be considering therapy for their child?
Letting parents know that it's quite normal to have mixed emotions about coming in and bringing your child into therapy. Some worry that they'll be criticised and told how they're meant to parent better. But I always keep in mind that parents are doing the best that they can with the knowledge that they have and the skills that they have. There's parenting books out there, but really no one is really born a parent, and a lot of the things that we learn are from our parents, which may have been helpful or unhelpful. I think keep in mind that when you're bringing your child to therapy, that the psychologist isn't there to just fix the child. You'll need to be quite involved as well. So I guess make sure that you're already in that headspace. Maybe you can consider seeing your own therapist so that the focus can be solely on your child rather than coming in. And sometimes parents view that space for them to vent as well. So really I need to focus on the child.
Yeah, that's really good advice. And another really difficult situation for parents would be seeing children escalate and behaviours really get out of control. And I imagine that's why a lot of families end up seeing someone like you. Is there any advice that you can give to our viewers for what they can do to de-escalate situations at home, or just things that they can remember when they're finding that behaviours are getting a bit out of control?
Sometimes there's a lot of negative language used on, the child acting up or they're trying to get attention. Another way of rephrasing attention seeking is attachment seeking. So something's going on for that child in that very moment. They're upset, their emotions are overwhelming, and they need to connect with someone in that moment, someone to help them realize that it's going to be okay, and that before children can really learn to regulate their own emotions, so we call it self-regulation, it's important to have co-regulation. The co-regulation is having that parent being able to have space for that child's emotions without being too overwhelmed themselves. Because if the parent becomes too anxious or overwhelmed, it kind of tells the child that, "Oh, this is way too much, your emotions are too much," when really we don't want that. And then we end up having, teenagers and adults around who have been raised to believe that it's not okay to have, distressing emotions, when really there's no good or bad emotions. They're all there to communicate something. So I think that what can also help in working with older kids is, think of them as an age a little bit younger than what they are, and what that child may need, picking them up, holding them, rocking them, being with them. And I'm not too much of a fan of time out, but it's almost like your emotions are too much. I have to go put you in a corner. You need to learn to calm down yourself. Whereas you want the child to know that there's an adult there who can manage their emotions.
What are some of the positive reinforcement sort of things that parents can do?
A kid can never have too much play. Sometimes parents think that play is just, you're not being serious, but there are lessons to be learned in play, such as I mentioned before, setting limits, that start and stop to play. When kids are able to play, there's a part of their brain that's activated where they can learn, create, and connect with other people. Whereas the alternative to play is perhaps, just telling a child what to do, being punitive. That puts them into more of a fear state in their brain. When people are fearful and they're in fight or flight, they can't learn or connect with people. You don't want that to happen.
All right. Well, thank you so much, Vanessa. There's so much there to think about for parents, and it's just so valuable having a chat to someone like you. And I guess it's really important for parents to know that there are child psychologists out there that can support through not just behavioural things, but also parenting and family situations. So thank you again for chatting to us today, and to keep up all of your amazing work.
Thank you.
And that's about it for today's show. Thank you so much for joining me. To watch these videos and more, head to the Channel 31 YouTube page. I'll see you next time.